As COVID-19 continues to evolve, my executive team and I discussed implementing an online video platform specifically for BCFD first responders, which will allow you as members the opportunity to learn more about COVID-19 and to submit correlating questions to COVID questions, the number 4, BCFD at baltimorecity.gov. Members from my executive team, including myself, will address your questions by way of video on a weekly basis, if not more. The leadership of the organization has really taken the time out to scour across the country and talk to other organizations, and also to talk to EMS organizations, fire organizations, to see what they're doing in relations to COVID-19. In fact, we had a conference call with Seattle's fire chief where he chronicalized all the issues and all the decisions they made. It gave us the ability to basically have a cheat sheet on some of the things we figured we might be going into. Consequently, we've been very prepared, and we realized there were a lot of things that we actually were online or even ahead of what they gave us because we had the opportunity to see the country go through other things. As Fire Chief of the City of Baltimore and the Baltimore City Fire Department, I humbly thank you for your service during this nationwide pandemic. As you remain dedicated to serving this great community and the citizens of the City of Baltimore, please know that as your Fire Chief, I will undoubtedly focus and remain focused on your safety as well as the safety of the community as we navigate through COVID-19.
Hi, I'm Charles Savella, Acting Assistant Chief of Operations for Baltimore City Fire Department. I'm here to answer some questions concerning operations from the members of Local 734 and 964. Currently, we have downloaded to our LMS Learning website, which can be accessed from a member's home as long as they've logged into it, the donning and doffing of our PPE videos. Those are on the site presently. I'm currently working with BCIT to make sure everything from the coronavirus file that is in BCFD forms is loaded into that tile as well. And the way to get to it is once you get into the LMS website, you go to Catalog, and then you scroll down to PPE, and that's where you will get all the information that's been placed into that folder. You can access it from home or from any computer or even your telephone. Currently, what we've been doing and what we've been doing since the beginning of this pandemic is we've been following CDC guidelines of sending members home to self-quarantine. But as a service to our members, we have decided and we have arranged to set up an alternative quarantine site. That site will be used for specific members that wish to use it. It's optional. If they would prefer to go home and self-quarantine, they're capable of doing that, and we have no problem with them doing that. If they would prefer to use the alternate site, when they check in with the infection control officer, he will have all of the details, where it is, how to check in, what to do, and we will give them an instructional packet once they check in, and then that way they would be able to self-quarantine. It is a hotel. We have set up a feeding service for them while they're there, and they will stay there for the period that is required, whether it's the 2 to 3 day or it could be extended to the 2-week possible quarantining. So the infection control officer will make the decision on that, and he will give full instructions. Now, just to be clear, if you choose to use the alternative site, we will get you your supplies from home. And also, once you've made that choice, you must stay there until you're cleared by the infection control officer. If you voluntarily leave on your own, you will not be allowed to re-enter. Well, actually, that's already been done. Starting this past Monday, 2-in-1 training was reduced to just 2 companies, 8 people. The truck training class that's done on Wednesdays was reduced to 1 company, 4 people. EMS training on Thursday was reduced to 2 medic units and an engine, one engine or truck possibly, 8 people. Elite training has already been canceled altogether. EMT training has been suggested to keep the limits to 10 people as far as people recertifying. As a matter of fact, the recruit class that's currently in the Baltimore City Fire Department, adjustments have been made to their training schedule in order to limit the social distance, or in order to keep the social distancing of these members within the guidelines of 6 feet so that we can still move forward with them, but yet keep them safe as well. We're working on that as far as limiting the amount of visitors to the firehouse. It may be difficult to actually screen them, but what we are going to do, and visitors also means off-duty members as well. So we will limit the amount of visitors, civilian visitors, that come to the firehouse. But for our members, just remind yourselves, our gyms that are in the firehouses are for on-duty members only. Off-duty members should not be coming in on their off time to use the gyms. Also, once you've been relieved, you should try to leave the fire station in a timely fashion, and such off-duty activities such as the house fund leader coming in and restocking shelves or soda machines, that needs to be stopped. All those type of actions should be done by on-duty members. This way it limits the amount of exposure that everyone gets, not only from the visitors on the street, but also from our members as well.
Christopher Case, Acting Assistant Chief of Community Risk Reduction. All members have been assigned PPE for responses to the COVID-19 virus, and also for any other emergency in the city. We continue to work with our vendors daily and are receiving more supplies to replenish all our PPE. An update for our 911 call center. 911 call center continues to update protocols for receiving calls for possible persons under investigation of the coronavirus. We were the first in Maryland to tailor our EMD to COVID-19. Fire communications, when they receive a call for a person under investigation, they enter this into the MDT. So it's imperative for all members to go read the comments and while responding to any run. All required PPE has been issued to our members, with more supplies coming in every day.
My name is Jim Matz. I'm the Acting Deputy Chief of EMS, and I wanted to take a few minutes to discuss some of the measures we're putting in place for the COVID-19 pandemic. I know it's a crazy time around our families as well as the fire department, but I wanted to point a few things out. We have legacy in the fire department with events like this. Over the past 20 years, we've addressed things like SARS, Ebola, H1N1, measles, as well as our chickenpox scare. I just want to point out that we're all here together. We have a great team, both within the fire department and within the city as a whole, working together to keep our members safe, as well as our citizens and our guests. We also actively monitoring the situation through different areas like the World Health Organization, the Centers for Disease Control, as well as the Maryland Department of Health and our local health department. And we're also filing guidances from these particular places. In addition, we're filing guidance from MIMS. MIMS's guidance is changing almost on a daily basis, and I wanted to point out we're actually have in the Word Documents folder a folder called Coronavirus 2020. There's actually 19 documents, if I didn't miscount, that are different guidance and publications we've put out. The reason there's so many guidances that come out is this is an evolving situation. Things are changing as we go forward. In the beginning, we were only worried about people that came from China with a 14-day travel history. At this point, we're up to anybody that has a fever or has respiratory symptoms or a cough or shortness of breath. So just bear in mind that things are changing frequently, and you are required to read these bulletins and become familiar with those. I'd also like to point out We are the fire service. We're well trained. We use PPE every day of our lives. The most important thing that I can put out right now is to make sure you use your PPE. Don't get complacent and follow the rules. We are developing plans for increased call volume. The latest reports from MIMS were that we can anticipate doubling our call volume. Our existing call volume runs between 400 to 600 calls a day. We'd be looking at 800 to 1,200 calls potentially per day. Some of the things that we're looking at doing at this time, we're looking at taking the alpha and omega calls off the top of our calls that come through dispatch. What we want to do with those, we're trying to set up a tiered approach where we're going to actually send those calls first to the MDO for a quick screen to make sure nothing that Charlie, Delta, or Echo call had gotten through mistakenly. And then what we're going to do is send that to a triage line with a nurse and or paramedics on place to try to resolve the call and save us from not going out there. If that doesn't work, our next level, and it's going to probably come down the road probably a couple weeks afterwards, is going to be telehealth or telehealth with a physician using the existing EMRC system we use for the radio. Hopefully the patient will relax talking to a doc as well as a provider on scene. Finally, we're also evaluating the possibility, if the patient's still not satisfied, of sending our mobile integrated healthcare unit, which includes an ALP, which is an advanced level provider, like a physician or a nurse practitioner, to help clear the call up. If the patient needs a prescription, write a prescription, and it'll be done. PPE, I can't say enough about personal protective equipment. We've had no exposures for people that are appropriately dressed in PPE. They're actually generating an order today that's going to mandate the use of PPE on all responses. The only exception is going to be the use of gowns. Gowns are to be used when you're doing aerosol generating activities. That's activities like even a nebulizer or bag valve mask and breathing or ventilating someone. The other thing I want to point out, and I'd like you to remember this, is through the proper use of PPE, you're going to protect yourself, protect your family, and protect our community. The state mandates that all hospitals report to us a positive case of COVID-19. Actually, it's only Alpha and Bravo at this time that we're looking at doing some different ideas and techniques to reducing our call level. They are researching potentially reducing the number of vehicles that go on those calls, but we're working on right now internally within the department is a tiered response to our Alpha and Bravo calls. What we're going to do is take the top of the Alpha and the Bravos, which is roughly 100 to 200 calls per day, or it works out to be 6 to 12 calls per hour. What we're going to do is funnel them into a nurse triage or a paramedic triage line. We're going to have them go ahead and see if they can get patients excluded that don't need to go to the emergency department at that time. The second tier we're going to use, probably coming online a couple of weeks later, would be the telehealth with a physician. Basically, what we're going to do initially is we're going to call an EMRC, speak with a physician if a patient is still not comfortable with thinking they have to go to a hospital or hospitalized for the COVID-19. To be proactive in this instance, the fire department is making aggressive moves and requiring all of our personnel in all responses to wear full PPE, which is going to be your N95 face mask, your gloves, eye protection, and then when you're doing aerosol generating activities, you want to use a gown. We're getting proactive and getting ahead of the curve with the latest reports that patients that potentially could have symptoms are not showing symptoms at all and are infectious. That's why we're requiring all members to wear full PPE for all patient interaction, to include eye protection, N95 mask, and gloves. And then if you're doing an aerosol generating activity, you should be using a gown.
Captain Timothy Cullen, Baltimore City Fire Department Infection Control Officer. At the start of the outbreak, to attempt to monitor the situation, I was asking the EMS officers to pass down to their members to notify me if there was any potential cases to try to start tracking. As the situation increased and there were more patients meeting the criteria, we had the patients being tracked through the Emergency Operations Center and through the medical duty officer. The information that was passed down was misunderstood. If the patient is tested or being tested by the hospital, we have to wait for test results. If the test results come back positive, then we would follow up with our exposure investigation process. There's no current protocol with the hospitals for us to be tested every time that we take in a suspected case. Because remember, just because they're a suspected case doesn't necessarily mean that they have contracted COVID or will test positive for that. The members took appropriate steps by donning the proper PPE. By donning the proper PPE, they limit the chance of exposure. Members that don the appropriate PPE and transport a patient with suspected or positive cases of COVID have little cause for concern of exposure. Again, there is no standing protocol with the hospitals that if we were to bring in a suspected case, that we were to be tested. If the hospital reports a positive case, then an exposure investigation would be initiated and then determined after consult with PSI.
Good morning. My name is Ben Lawner, privileged to serve as the Medical Director for Baltimore City Fire Department. First of all, to be very clear before we get into some of the subtleties, no. Right now, the scope of practice of emergency medical services is dictated by the Maryland Medical Protocols. This is a job, unfortunately, that does involve risk normally. And currently, the protocol, and I would say the standard of care, is to engage in resuscitation for patients that are not breathing or breathing ineffectively. So it's pretty clear that if somebody requires an assisted ventilation, then they would need either a bag valve mask, naloxone, or some other procedure. Now, it's also true that in the era of COVID, in the era of new infectious diseases, bag valve masking and aerosolized procedures and CPAP and all of these things carry increased risk. And obviously, as a medical director, as a clinician, as a longtime participant in the Baltimore City Fire Department, we have to protect ourselves and our membership. So my recommendation would be, since this is a standard of care, that it is so important, as echoed by Captain Cullen and others, to have your PPE on, especially for respiratory distress calls, because as we know, these calls can escalate quickly, and if somebody is not breathing, that is certainly not the time to don personal protective equipment. In other words, it should be done before. Now, that being said, it's very clear that the protocols say one thing. I'm a big fan of giving clinicians a lot of latitude, but I think we can all agree that if somebody is not breathing or breathing ineffectively, they're going to need support. Now, we may very well get into a situation far down the line where we're in a multiple casualty incident and disaster standards of care apply. That's entirely different. Right now, under sort of enhanced operations, we're still adhering to utilizing bag valve masks. The other thing I would say is we meet every day in the Baltimore City Fire Department, and I take full utilization of my contacts over at Baltimore City and at University of Maryland, and we are trying to figure out ways of decreasing the risk. So one thing we'll be rolling out is HEPA filters and bag valve masks that can create a little bit more of a closed circuit to decrease any of the aerosolization. And the other thing that you can do while bagging, in addition to the usual PPE, is make sure you have a good seal. So if the patient tolerates it, you want to try to have an oral pharyngeal airway to diminish the resistance so you can bag effectively without any increased resistance or aerosolization.
Hello, my name is Lisa Wood and I'm Director of Human Resources. First, I'd like to take a moment and thank all of you for your continued dedication and service to both the fire department and the citizens of Baltimore City. What I'd like to speak to for a moment is the fact that I want to ensure to all of you that our administrative functions will continue throughout this time. Though we are certainly working with all of our staff to work through social distancing and setting up telework for them, all of our functions in both HR and fiscal will continue. We'll ensure that there will not be interruptions to things such as payroll, purchasing, and HR functions. We know that these functions support you in your day-to-day work, and we're going to ensure that they continue. On another note, I would like to remind all of you of some services that are available to you during this time. One is our service through BHS. I want to remind you that you can reach out to them 24/7. They offer many different things for you. One is, of course, you can reach out to them for things such as tips and ideas. If you might have children at home right now due to school closings, they can offer up ideas about how you might keep your kids active or additional learning ideas. They also might help you through some additional thought processes. You can call in and speak to someone if you like. Another idea we have is we also have our app called Burn Along. They can offer you tons and tons of videos for exercise, meditation, yoga through an app, and you can just download it. These are all excellent self-care ideas. So I encourage all of you to take advantage of these. We'll be sending these out through your email, so I encourage you to make sure that you check your emails regularly so that you can see these ideas. Please send any questions you have to COVID questions #4 BCFD@baltimorecity.gov.